So this is a large database of patients in serum. And all these patients have lymphoma. And they come generally from the upper Midwest, and they're part of our SPORE grant. SPORE stands for Specialized Projects of Research Excellence. This is a government grant to study lymphoma. And we have this grant with the University of Iowa. So every new patient that comes either to the University of Iowa or Mayo that has lymphoma, they consent to provide us a dietary history, and we also draw a serum sample from them at the beginning. And so we bank all these, and we've been doing this for about 8 years now. And this provides a very nice opportunity to go back in time and look at these serum samples and do a specialized test on them. So we've been noticing in the literature that people who are vitamin D deficient, for example, those with breast cancer, it's been shown, and non-small cell lung cancer, that those people have a worse prognosis if they're vitamin D deficient. So we decided to look at our database of lymphoma patients. And so we took diffuse large B-cell lymphoma, which is a very common type of lymphoma in the United States, and we simply went back into that database and looked at cracked open the serum vials, did the vitamin D analysis, and then since those patients had already had quite a bit of follow-up, we were able to relate that to their risk of relapsing from the lymphoma and the risk of dying from any cause. And what we showed in that study that indeed if you were deficient, and about 50% of the patients were deficient in vitamin D, they had a worse prognosis. They tended to die more often than those that had a normal vitamin D. And this seemed to track a little bit with some of the things like stage and symptoms, but it was really, when we did a statistical analysis, an independent factor, which means that it was more than just tracking with one of the other commonly used factors. And so this is a very intriguing thing because vitamin D is an important vitamin. It's important to our immune system. And perhaps it's affecting the way these patients are able to fight their tumor.
So if you look at the United States and where B-cell lymphomas or lymphomas tend to occur, there tends to be a gradient with a higher proportion of patients developing lymphoma the further north you go. And the further north you go, there's also less exposure to sunlight. Sunlight is very important for vitamin D conversion in the skin. And because of this, we thought that vitamin D might be a natural place to look, to see if there are differences in patients who have low vitamin D levels versus normal vitamin D levels and how they do with their lymphoma.
This is the first study that's found this association. It's fairly strong. It definitely has our interests, but we have to emphasize it was not a clinical trial, so we weren't actually replacing people's or normalizing people's vitamin D levels and seeing the outcome. We just know that people with low levels had poor outcome. So we'd like to see this again. We need to do a little more clinical research on that. I think it's a very encouraging finding to follow up on, but we would caution people that, like all research, it takes time to get all the data together to make more definitive conclusions. However, having said that, we know very well that people with low vitamin D levels are at multiple health risks, and the clinical standard out there is to replace if you are low. So, and it's quite striking that the rates of deficiency in our patients are actually the rates of deficiency in the general population. So there are a lot of people out there with low vitamin D levels who might consider talking to their physician about that.